right, so as we saw there, every day new COVID-19 vaccination sites are opening up. Not a moment too soon, of course, with a third wave already hitting some provinces. Let's discuss our vaccine rollout progress now with Dr. Anban Pillay, Deputy Director General in the Department of Health. Dr. Pillay, thank you so much for your time. I just want to pick up on something that came up in Heidi's report there. There's a quote from a pharmacist who says, up to Thursday, the Department of Health was going to cover everybody as a free vaccine. We've got a letter, though, on Thursday saying we will be responsible for the vaccines from biotech on a 90-day account, and we will have to charge people. This is totally against what government said. Could you please clarify the payment issue?
So the agreement around the vaccines is that the government purchases the vaccines, and for the private sector, that is those that are on a medical scheme, the pharmacist will bill the medical scheme the cost of the vaccine as well as the vaccination. After being reimbursed the funds of both the vaccine and the vaccination, the pharmacist will then pay the distributor, which may be DSV or BioVac.
All right, so if I'm understanding
the patient wouldn't pay anything.
I see. So in other words, basically the medical aid will pay the pharmacy back. Is that correct?
That's right, yes. And we would certainly also be contracting pharmacies where a person doesn't have a medical aid. The Department of Health will then reimburse the pharmacist directly, both for the vaccine as well as the vaccination through a credit system, which will involve, again, BioVac or DSV.
All right, thank you for clearing that up. I want to ask you, how many vaccinations have we done so far? What's the full tally?
I think the team will probably just announce that in the next hour or so, but I know for yesterday we did over 40,000, and I think today was much better than that from the indications that I got. So we're, certainly ramping up over 50,000, I think was today, from the last check. So I think the team will probably confirm those figures in the next hour or so, making sure all the paper-based records that could potentially be part of the system are, which is I think is a significant increase from when we started in the first week. I'm hoping that we continue with this trajectory of an increase as we get more and more doses in. We should be increasing our vaccinations as well.
All right. Now, we've done the maths here at eNCA, and we know that you have to do, I think, at least 120,000 jabs a day to get to those 5 million or so over 60s at the end of June, which, of course, is your self-imposed deadline. Are you confident you'll get to that rate?
Yeah, I think we must make every effort to try to get to that rate. At this stage, remember that we're getting about 300,000 doses every week. Based on that, we basically are going to have to manage our vaccinations to be on average between 40 and 50,000 a week, so that we make sure we don't run out of vaccines over this period. The 120,000 that you're talking about is accurate, but that's an average over the entire 6-month period. Remember, after July, the quantity of doses coming through are fairly significant, and so we would be pushing through a lot more then as soon as all those doses become available. And across the public and private sector, we had identified around 3,000 facilities. So we think that during that time we can turn all of those facilities on, because there'll be sufficient doses for everybody. At this stage, we're obviously still in the constrained environment where we're getting 300,000 a week. Next week, well, it increases to 600,000, but as soon as we hit July, the companies have somehow been able to ramp up their production, and we'll get a lot more then.
Yeah, it's so frustrating, of course, because we know that there's a huge amount of Johnson & Johnson vaccines sitting waiting in Gqeberha. Now, my understanding is this is all because of the mix-up at the factory in Baltimore, where they mixed AstraZeneca and Johnson & Johnson vaccines, heaven knows how. But an article I read, I think in the New York Times today, said that in South Africa it's also up to our regulators to give the go-ahead. So please tell me, what's the hold-up, and how quickly are we going to see those vaccines coming to us from Nelson Mandela Bay?
So I think the vaccines are ready. We understand from our colleagues at Aspen that, look, all's ready. I mean, they just need to push the button, and I think the trucks will leave the factory and bring the vaccines to all the sites. The issue is that the regulator, SAHPRA, needs to have confidence that the product that they're allowing to be released is not in any way affected by the issues that previously affected that site in the US. Now, they're waiting for the United States FDA to give them a report around the inspection and assessment of that site so that they are fairly confident about the quality of the product. I think the worst thing for us is to release the product and then to find out that there's a problem with it and recall it or the like. So we really don't want to do that. So we'd rather just make sure that we are confident about its quality first.
All right. I want to speak to you about wastage. There was some really good news on Monday from Pfizer that actually the vaccine, once defrosted, doesn't have to be discarded after 5 days. It actually can last for 31 days. I'm sure that's quite a big game changer in terms of worries about wastage. So talk to me about the wastage concerns. How much has been wasted so far? Or are you doing quite well with monitoring what gets defrosted and when?
So I think it's fair to say we're really excited around the change in the temperature requirements because the previous requirements were only 5 days in the fridge. And that really restricted the sites that we could use, both in the public and private sector. So you saw initially a lot of sites being fairly limited in terms of the quantity and the number of sites as well. Now that this news has come to bear that we can actually keep it in the fridge for up to 30 days, many more sites, pharmacies and clinics can keep this vaccine. The wastage factor has been minimal in terms of the temperature side of things. The challenge is more on drawing the doses, given that you have to dilute the frozen powder and then draw up the dose. And if you incorrectly dilute the quantity, you will then not be able to get sufficient doses out. But thus far, all of the sites that we have been talking to have been saying they're taking a little bit of time to do this, but they're getting it right and they're able to extract 6 doses out of a vial. Yeah.
What is the department's policy on walk-ins? We've heard that at times there were computer glitches, and in order to just get vaccination going, certain sites have allowed walk-ins. Are you against it, or do you think that actually sometimes it's an important thing to allow?
I think walk-ins are important, but there needs to be a balance between the number of scheduled vaccinations and walk-ins. Certainly when you have a number of bookings in a day, a site may experience quite a few cancellations because in the Sisonke study, I know at some point we had about 30% of people not pitching up for their vaccination on the scheduled day. And so in the current environment, some of the sites are also experiencing that. So they need to fill those with walk-ins, certainly. And there are people who are unable to register on the EVDS but want a vaccination. So they simply come to one of our sites and say, I want a vaccination, I haven't registered. They register them, and obviously the site will try to accommodate them. What we've done is said that on the EVDS system that they use for vaccination, that each site will decide as to how many bookings it's going to accept and how many walk-ins it's going to accept. And each area, I think, is going to be different. So we don't want to be prescriptive at a national level and decide that for a particular site. But I think the colleagues in the sites actually have a good sense of the community and how many people are going to book and how many are going to pitch up. The problem is everybody, if they decided to walk in, there'll be a chaotic situation. So it's very important that we also emphasize that bookings are a key part of making sure that this is an orderly process.
All right. Well, I want to thank you so much for your time this evening. That was Dr. Anban Pillay, Deputy Director General in the Department of Health.